Welcome. Today, we're diving into the world of neurological conditions to explore autoimmune tremor, a complex disorder where the body's own defenses turn against it, leading to involuntary shaking. We'll uncover what causes this condition, how it affects the body, and what can be done to manage it. The exact cause of autoimmune tremor remains a puzzle, but it's understood to be an autoimmune disorder. This means the body's immune system, which is designed to protect against foreign invaders like bacteria and viruses, mistakenly attacks healthy cells in the nervous system. Specific antibodies targeting neuronal structures are suspected, but identifying the precise triggers and target antigens is an area of ongoing research. Genetic predisposition and environmental factors might also play a role in increasing the risk of developing this condition. In autoimmune tremor, the misdirected immune response primarily targets components of the nervous system involved in motor control. This can include the cerebellum, which coordinates movement, or the peripheral nerves that transmit signals from the brain to the muscles. The autoimmune attack leads to inflammation and damage in these areas, disrupting the normal neural circuits responsible for smooth, coordinated movement. This disruption manifests as a tremor, an involuntary rhythmic shaking. The specific location and severity of the autoimmune attack influence the characteristics of the tremor. Autoimmune tremor is considered a relatively rare condition, making it difficult to pinpoint its exact prevalence. Due to the diagnostic challenges and potential for misdiagnosis with other tremor disorders, epidemiological data is limited. It appears to affect individuals of all ages, although some studies suggest a higher incidence in certain age groups. Further research is needed to accurately determine the global prevalence and demographic patterns associated with autoimmune tremor. The primary symptom of autoimmune tremor is, of course, a tremor. This tremor can vary in its characteristics. It might be an action tremor, appearing during voluntary movement, or a postural tremor, occurring when holding a position against gravity. The tremor's frequency and amplitude can also vary. Beyond tremor, some individuals may experience other neurological symptoms, such as imbalance, incoordination, cognitive difficulties, or sensory changes. These additional symptoms depend on the specific areas of the nervous system affected by the autoimmune process. Diagnosing autoimmune tremor can be challenging because tremors can stem from various causes. The diagnostic process typically begins with a thorough neurological examination to assess the tremor's characteristics and identify any associated neurological signs. Blood tests are crucial to look for specific autoantibodies that might be targeting the nervous system. MRI scans of the brain and spine can help rule out other structural causes of tremor and identify any inflammatory lesions. In some cases, a lumbar puncture to analyze cerebrospinal fluid might be performed to look for signs of inflammation or immune activity within the central nervous system. Ultimately, the diagnosis relies on integrating clinical findings, antibody test results, and imaging studies, while excluding other tremor disorders. While autoimmune tremor isn't rigidly classified into distinct types, in the same way some other diseases are, it's helpful to characterize it based on the predominant type of tremor observed, action Vs. Postural and the suspected area of the nervous system targeted by the autoimmune response. For example, a tremor predominantly affecting the hands during voluntary movement might suggest a cerebellar component. Further characterization could consider the presence and severity of other neurological symptoms to paint a more complete picture of the individual's condition. The goal of treatment for autoimmune tremor is to suppress the autoimmune response and alleviate symptoms. Immunosuppressant medications, such as corticosteroids, azathioprine, or methotrexate, are often prescribed to reduce immune system activity. In some cases, intravenous immunoglobulins of VIGA therapy or plasma exchange may be used to remove harmful antibodies from the bloodstream. Symptomatic treatment focuses on managing the tremor itself. Medications like beta blockers, primidone, or topiramate may help reduce tremor amplitude. Physical therapy, occupational therapy, and assistive devices can help improve motor control and daily function. In severe cases, deep brain stimulation of BSA, a surgical procedure involving the implantation of electrodes in the brain, might be considered. Currently, there are no known preventive measures for autoimmune tremor. Because the precise causes are still being investigated, we lack specific strategies to prevent the initial autoimmune attack. However, maintaining a healthy lifestyle, managing stress, and avoiding potential environmental triggers might contribute to overall well-being and potentially reduce the risk of developing autoimmune disorders in general. More research is needed to identify modifiable risk factors. The prognosis for autoimmune tremor varies depending on the severity of the condition, the extent of neurological damage, and the individual's response to treatment. Some individuals experience significant improvement with immunosuppressive therapy, while others may have persistent symptoms. Early diagnosis and treatment are crucial to minimize long-term neurological deficits. Recent research is focused on identifying the specific autoantigens that trigger the autoimmune response, which could lead to more targeted therapies. Studies are also exploring the potential of new immunomodulatory drugs and stem cell therapies to treat autoimmune neurological disorders, offering hope for improved outcomes in the future.